Welcome to the RCI GDAS webinar, St. Louis University Mental Survey Exam, also known as SLUMS, presented by Cindy Holloway. Before we get started, let's cover a few conference details. If you have a question during the conference, we ask that you type in the question. All questions will be answered at the end of the conference. Also, if you are at your own computer station, a post-test survey will pop up at the end of the webinar. There will be 10 questions about the webinar and personal information questions such as your name and email address that will enable me to send you your certificate. If you are not at your own computer, copy down the link that is posted on the last slide of the presentation. Use the link at your own computer to complete the post-test. Certificates will be sent within 1 week after the closing of the test. Please complete the test by November the 13th in order to receive your certificate. We are now ready to begin. Welcome, Cindy Holloway.
Thank you, Elaine, and I want to welcome you to this webinar. My name is Cindy Holloway, and I just wanted to give you a little bit of my background and why I'm doing this webinar on the SLUMS. For 18 years, I served as director of a Alzheimer's residential facility as well as an adult daycare program. And during this time frame, in order to determine whether we were able to care for people that were suffering from dementia and related disorders, then I would do either the mini-mental status exam or the SLUMS prior to admission into the program. In addition to that, as serving as a member of the board of the directors of the Alzheimer's Association, I did care consultating for the association and also assisted them in performing this portion of an assessment. Let's go into what exactly the SLUMS is. It's the St. Louis University Mental Status Examination. And the St. Louis University researchers used the SLUMS and the mini-mental status exam to test 705 men who were at least 60 years old and treated at the Geriatric Research Education Clinic Center at the Veterans Administration Hospital in St. Louis in 2003. They found that while both tools detected dementia, only the SLUMS recognized a group of patients as having mild cognitive problems. It takes about 7 minutes to administer, and it's a 30-point screening questionnaire and very easy to administer. The 4 areas that it tests for is orientation, memory, attention, and executive functions. Let's look, before we go into the detail of the SLUMS form itself, as to why it's important to get an early diagnosis. An early diagnosis is very important to rule out reversibility. Anytime that you have a presentation of confusion and other symptoms of dementia, it could be either a reversible form or a non-reversible form. So it would be a very sad state of affairs if somebody was living with dementia when it actually could be reversed. Another reason why we shouldn't tolerate unrecognized dementia is noncompliance with medications. There are some medications on the market now that would assist them with symptom control. Also, unrecognized dementia leads to unaddressed symptoms, either through behavior modification or through the approach of the caregiver, or through pharmaceutical modification. Then there are some symptoms that are very difficult for care receivers to live with, and then knowing exactly what they're suffering from aids in a recognition of the fact that they cannot control these symptoms, and as a result, then it depends on outside forces in order to help them live with it. Another thing is unaddressed safety needs. There's so much to watch out for when caring for someone with dementia or overseeing their care and their activities of daily living. And so having a diagnosis aids in providing those safety needs. Also, it prevents victimization. There's so many that are living alone with dementia, whether reversible or non-reversible, that are prey to victimization, either financial or physical or mental. And having a diagnosis and recognition of what their problem and their needs are helps prevent this. Also, an early diagnosis will aid caregivers in preventing crisis and catastrophic reactions. Knowing how the disease may present then helps them prepare and educate themselves on how to avoid these situations. I wanted to look for just a minute at the non-reversible dementias, and I'm not going to tarry very long on this because we've had several webinars on details of these. The most prevalent is Alzheimer's. Vascular dementia is next. Mixed dementia could be a combination of Alzheimer's or vascular or any of those below. Hicks disease, Lewy body, Parkinson's disease, traumatic brain injury, Huntington's disease, Creutzfeldt-Jakob's disease, and then mild cognitive impairment. Now, I want to point out here that mild cognitive impairment is a diagnosis that is now recognized by the medical field. But having a diagnosis of mild cognitive impairment does not necessarily mean that it's going to advance into full-blown dementia. A person with that diagnosis could live in that state of mild cognitive impairment for the rest of their lives. Okay. Now the next slide we'll look at the reversible dementias. Now these are treatable medical conditions with Alzheimer's or related dementia type symptoms. And the first of those is depression. In the elderly, depression can mimic a dementia state. Or a person with dementia can also be suffering from depression as well. Infections such as urinary tract infections, electrolyte imbalances, blood sugar imbalances, adverse drug reactions, B12 and thyroid problems. Constipation and impaction can severely impact the cognition of an elderly person. Brain tumors and head traumas as well. I want to point out that the B12 deficiency, the thyroid problems that they're suffering, and the electrolyte and blood sugar balances those are generally the ones that can be reversed. That's a rule out right there. And let's look at the next slide. These are some of the common symptoms of dementia. Memory loss can be presented in reversible and non-reversible. Language and communication problems. General confusion. Again, that can present in reversible and non-reversible. Difficulty with abstract thinking. lack or lapses in judgment, difficulty performing familiar tasks, and this may be something that's intermittent, as well as any of the other symptoms. Misplaced objects, behavior or personality changes, sudden mood swings, loss of initiative, or apathy. Now, I want to point out that someone with dementia may not suffer from all of these symptoms. They may have a few, or they may suffer from some of them, as I said, intermittently, and that's something that's very perplexing to family and caregivers, is why they would have a problem with confusion on some days and others they don't. But that intermittent symptoms is something that's very common with any dementia. Now, how will we know whether it's reversible or non-reversible? Well, we don't. As assessors, we'll never know that. And a cognitive assessment is going to give you just a piece of the puzzle. It's not going to give you enough of the whole picture in order to determine whether the person is suffering from a reversible or non-reversible. It should also include a medical history from either the patient, a relative, or a friend. It should include activities of daily living history as well. You know, what their routine is, whether they are presenting outside of that routine. What has their judgment been impaired? What has indicated that this is going on? What alerted you to the fact that you're having a problem with your memory or your judgment? Those are the things that a good assessor would find out. In addition to that, the cognitive test, also neuropsychosocial testing can help with determining what kind of dementia it is, and that's other than the simple cognitive assessments that we're going to be doing today. CAT scans, MRIs, and PET scans are often used now and approved by most insurance companies in a complete assessment. This is not the first thing that's done, but after others have been ruled out, then the insurance companies will usually pay for these. EEG, the thyroid function test, B12 and folic acid levels, chest X-ray, EKG, blood work, and urinalysis. All right. Now let's look at some of the clues to cognitive deficit during assessment. Some of the things would be missed appointments, forgetting all or part of a conversation, refusal to participate in an assessment out of fear of what it's going to reveal, anger or agitation. When someone with dementia is pushed beyond their capabilities, this may be how they demonstrate their frustration is through anger or agitation. Compensation. An example of this would be if you ask a grandmother, how many grandchildren do you have? And she says, well, honey, I have got so many grandchildren, I just can't even keep up with them. When actually she may not have but 3 or 4, but she is just compensating because she cannot remember at that time the number of grandchildren that she has. Repetitiveness, paranoia, rambling, and also language deficit. Now, in assessing an older person, I had mentioned earlier that you need to obtain family, social, employment history, also their educational history as well. Obtain their medical history. Help to reduce test anxiety. one very good way of doing this is to let them know that this is a lovely little exercise and there's no pass or fail to this examination. Reduce distractions. Make sure that telephone is not going to ring during the middle of the exam. The television is turned down, and that they're in a place where they can hear properly. Also compensate for any vision loss. You can do this on the exam with several of the clock drawing tests, and also there is one that they have to identify certain forms, and you may have to enlarge those. And then something that I call therapeutic positioning. That's sitting where you are a peer of the person that you're examining rather than having a desk between the two of you. That sets you up as an authority there that are testing them, and that's not really a comfortable place to be. All right. Also, you're building a relationship before you go into the exam. Tell your client that you anticipate that this is going to be a pleasant experience for both of you. That sets the stage right there. Then put a smile on your voice. Put a smile on your face if you're doing a face-to-face or pen and paper exam. If you're doing a telephone assessment, then put that smile in your voice. We certainly don't want to be we don't want to be judgmental or critical. It's very important to show nothing but acceptance, and no matter what you hear. Empathy is something that you would use in small doses. You can be too empathetic with a client and end up straying too far away from what you're trying to accomplish. Be encouraging, unbiased, and neutral. One thing that I would suggest to you if you're going to be conducting this exam is to practice. Find a coworker or someone that is willing to be tested and practice on one another. And that way you can detect things like bias or an inappropriate technique. Years ago, I had a dear friend that was in school and studying psychiatry, and she loved to test on me. And I told her, I said, there must be something in this. I was one of her favorite subjects. Okay, let's look at the exam itself. As you can see at the top, there's a place for the name, age, and is the person alert, and level of education. Everything is self-explanatory here. I want to make a note that in putting in an answer to is the person alert, you wouldn't answer this with either a yes or a no. What they're asking is what their level of alertness is. And we're going to go into more detail about that as we go through the details supplied by St. Louis University. Level of education. This test is sensitive to a person's level of education, and so you have two different scoring grids. One is for a high school education or above, and the other is for less than a high school education. Over here on the left is your scoring box, which corresponds to each one of the questions. Blank out of 1, there's 1 point that you would receive for answering this question correctly, and so on. The total highest score that you can receive is 30, and in each one of these little blue dots, it tells you how to score for a partial answer. For instance, on question 6 here, in naming as many animals as you can in 1 minute, if you named 1 to 4 animals, you would get a no score on that. 5 to 9 would be 1, 10 to 14 would be 2, and 15 plus animals would be 3, and so on. There's also a place for the examiner's signature, the date, and the time as well. Okay. Now, on this slide, it shows you what each one of these questions test for. And let's go back to the test itself and look at those just briefly here. In question 1 through 3, we're looking at attention, immediate recall, and orientation. 4 and 6 is delayed recall with interference. And then 5 is numeric calculation and registration. 6 is immediate recall with interference, and that's with a time constraint. Question 8 is registration and digit span. Question 9 is visual spatial and executive function. 10 is visual spatial only. And then question 11 is executive function, and that is in a oral story that you answer questions on. Okay? So moving on to the next slide here. This is provided by the Veterans Administration, St. Louis University, and this gives you detailed information about how to question and how to avoid the pitfalls of doing it incorrectly. And so I'd like to go through this. It says on number 1, complete the resident's demographics at the top, and we recommend that you put the date and name of the evaluator at the bottom of the page as well. This is, if you refer back to this exam, that's good information to have later on. Number 3 says administration should be conducted privately and in the examinee's primary language. Be prepared with items that you need to complete the exam. You'll need a watch with a second hand. Record the number of years the patient attended school. If they obtained associates, bachelor's, master, doctorate, etc., then note the degree achieved instead of the actual years of school attended. Number 5 is determine if the patient is alert. Do not answer yes or no, but indicate their level of alertness. Alert indicates that the individual is fully awake and able to focus. Other descriptors include drowsy, confused, distractible, inattentive, preoccupied. Some others that are not listed here might be anxious. It could be that they are intermittently focused. There's any number of ways to describe their alertness. Number 6 is to begin by asking the patient the following. Do you have any trouble with your memory? May I ask you some questions about your memory? And of course, this is just appropriate to get permission. Read the questions aloud clearly and slowly to the examinee. And it's not usually necessary to speak loudly, but it is necessary to speak slowly. I also want to say that you'd want to be face-to-face with them within a comfort zone to where you're not invading their personal space, but you do want to get close enough that if they do have a hearing problem, they're able to hear you. Read the questions. Okay, I did that one. Number 8, begin by asking the patient something similar to the following. Do you have any trouble with your memory? May I ask you some questions about your memory? I'd like to see how good your memory is by asking you some questions. You may need to reassure the patients by telling them that this is not a test that they can fail, but merely a tool, much like a thermometer that takes the temperature of their mental status. And then what this does check is the amount of memory they have. Number 9 just says score the questions as indicated on the exam. Number 10 is on question number 4, read the statement as listed on the exam. Ask the patient to repeat each of the 5 objects, apple, pen, tie, house, car, that you recite to make sure that they heard you and understand what you said. And they can repeat these as many times as it takes for the patient to feel comfortable that they can answer it back correctly to you. Moving on. Number 11 is, on question number 5, make sure that the patient is focused on you prior to reciting the information. Obtain an answer for the first part of the question, how much did you spend, before moving on to part 2, how much do you have left? Do not prompt or give hints, but do give ample time for the patient to answer the question. If they ask you to repeat the question, you can do so only once. Number 12 is to redirect the patient's attention, if necessary, back to you to answer question number 6. Give them 1 minute to complete the question, and be sure to time them. This is where you're going to need your watch or device with a second hand. Continue with the exam questions in the order as listed as number 13. Number 14, on question 8, state each number by its individual name. Rather than saying 87, you would say 87. Rather than 649, you would pronounce it 649, and so forth. On question 9, either draw a large circle on the back of the examination form or have one pre-prepared on a separate sheet with a larger circle so they can see it well. And when scoring this question, give full credit for either all 12 numbers or all 12 ticks. If the patient puts only 4 ticks in the circle, prompt them once to put numbers next to those ticks. The 12, 3, 6, 9 for full credit. And remember, you would just prompt them once on this. When scoring the correct time, make sure that the hour hand is shorter than the minute hand, and that the minute hand points to the 10 and the hour hand points to the 11. You may also provide a separate sheet with larger examples of the forms listed on question 10, and that's for the visually impaired. And this sheet should be created by enlarging. You can just enlarge the figures or draw them yourself as long as they're in scale to the original figures. Read question 11 as written and provide ample time to answer each question. Do not repeat the story, but do make sure that they're paying attention the first time you read it to them. Do not prompt or give hints. The answer of Chicago as the state that she lives in gets no credit, but you may prompt them once by repeating the question. And then the rest of it is just about scoring it on the form. Now, the next slide, the VA and university provided some instructions to administrator in a brief form, and it tells you what each one of the questions is scoring for, orientation and attention and so forth. Okay? I just wanted to provide that for you. And if you want to go to the University of St. Louis website, they also have available these forms that you can download as well. Now, what we're going to do is we're going to move on to actually doing an examination. I have one of my coworkers here, Gail Austin, who has volunteered to be our demented person today. And she's going to play the role of Tony Brown. Okay. Now, we're going to start the exam. Good morning, Ms. Brown. How are you?
Good morning. I'm doing pretty good. I'm a little nervous.
Well, that's understandable, but I want to reassure you that in this we are testing for your memory. And
that's what I'm nervous about.
Yeah, I understand. But there's no pass or fail to this test. We're just going to see what degree of memory problem you have, since you had indicated that you are you're a little concerned about having a memory problem.
Yeah.
Yeah.
Scary.
Yeah. I can understand that. Now, what I'm going to be doing is I'm going to be asking you some questions, and I'm going to give you ample time to answer each one of these questions. Okay? How are you feeling today? Let's start off with that.
I feel fine, just a little nervous.
Little nervous?
A little nervous.
Okay. Well, that's understandable. And I just want you to relax, make yourself comfortable.
Okay, I'll try.
Okay. Yeah. And can you hear me well?
Yes.
Good. Good. Okay. The first thing I want to ask you, which is not part of the test, is what is your level of education?
I got my master's degree.
Okay.
Back in the dark ages.
Okay. Very good. Now we're going to start the exam.
Oh, okay. Okay.
All right. What day of the week is this?
Oh, it's Tuesday. I know that one.
Good. What is the year?
2012.
Very good. What state are we in?
Georgia.
Now, see, this is not so difficult.
Oh, this
You're doing
fun. Can I stop now?
No. You're doing a fine job. Now, what I'm going to do is I'm going to say 5 items. I want you to repeat these items after me.
Okay.
Okay? And then I'm going to ask you to remember them. And then I'm going to question you on the 5 items a little bit later on.
Okay.
Okay. All right. And we'll repeat these several times.
Okay, good.
Good. Okay. The first one is apple.
Apple.
Pen.
Pen. Am I a pen, sticking pen, or a writing pen?
Either one.
Either one. It's my choice. Okay.
Yeah.
Okay, I got a pen.
Okay. Tie.
Tie.
House.
House.
And car.
Car. All right.
Okay. Let's say those again.
Okay, good.
All right. Apple.
Apple.
Pen.
Pen.
Tie.
Tie.
House.
House.
Car.
Car.
All right. Now, this time I'm going to say all 5 of them, and then you repeat all 5 of them after me.
Oh, okay.
Okay. Apple, pen, tie, house, car.
Apple, pen, tie, house, car.
Very good.
Okay.
All right.
I got it right this second.
Okay.
Is that all?
For now.
Okay.
All right. The next question is, you have $100, and you go to the store. Ms. Brown, excuse me.
Yes.
Yeah.
Yes.
Okay.
I'm sorry.
That's all right. That's all right.
I got distracted there. All right. I'm with you.
Okay. Let's start it over again.
Okay.
You have $100. $100. You go to the store, and you buy a dozen apples for $3.
Okay.
And a tricycle for $20.
Okay. I don't know what I'm going to do with a tricycle, but okay.
All right. And how much did you spend?
23.
Right. And how much did you have left?
Oh, my gosh. 82.
Very good.
Right? Okay.
Now let's move
I never
on.
did very good. My husband would not even let me balance a checkbook because I'm terrible with that. So I hope I did okay.
Well, you know, a lot of people have that problem. You're in good company. So let's move on to the next question.
Okay. All right, I'm ready.
All right. This is one of those fun little things. And what we're going to do is I'm going to time you as you name as many animals as you can think of in 1 minute.
Animals.
Mm-hmm.
Any animals?
Any animals. Okay. Now, start.
Cat and dog, horse, cow, kangaroo, giraffe, lions, tigers, and bears, squirrel, monkey, orangutan. My mind's just blank.
That's okay. Let's give it another few seconds.
Okay. Mule.
Good. Stop.
Okay.
All right. Very good.
I used to have a mule.
Oh.
His name was Shadow.
Shadow. Oh, that's an interesting name. Was it afraid of its shadow?
No, he was gray.
No.
He's big. He's a big mule.
Okay. Now, we're going to move on to the next question here.
Okay.
Okay. Now, what were those 5 objects I asked you to remember?
Okay. Apple and a pen sticking in it, and a car, house, apple, pen, car, house. Oh, I can remember.
Well, you did very well.
Did I? Was
yes,
that okay?
you did. Yes, you did. You did very well, Miss Brown. Okay. All right. Now, Miss Brown. There we go.
Yeah.
Okay.
You got me.
Okay. Miss Brown, I'm going to give you a series of numbers, and I'd like for you to give them to me backwards.
I don't like numbers.
Oh, I know, but this is fun.
This is fun.
Yes, it is. Let me give you an example.
You need to get out more.
Okay. Let me give you an example here. If I say 42, then you say 24.
Okay.
Okay?
Okay.
All right. The first one is 8, 7.
7, 8.
Right. 6, 4, 9.
9, 4, 6. Did I get that right? 9, 4, 6.
All right. The next one is 8, 5, 3, 7.
3, 7, 5, 8.
Good. Now we're going to move on to the next one.
And I hope it doesn't have numbers.
It does have some numbers, but it's something you're very familiar with.
Okay.
Okay. Now, this is a clock face.
Yes.
And what I'd like for you to do is please put the hour markers in the appropriate spot and the time at 10 minutes to 11 o'clock.
So you want me to put, like, the numbers where the hours should be?
That's right.
Okay. And then what time?
10 minutes till 11 o'clock.
10 minutes till 11. Okay. Okay.
Okay.
There you go.
Very good. All right. Now, here is a series right there of figures.
Yeah.
And what I'd like for you to do is to put an X in the triangle.
Okay. I can do that. There you
go. Now, which of these three figures is the largest?
By largest, do you mean tallest?
Largest.
The largest. Okay, so I think it's this one.
Okay. All right. Here we go.
There you go.
Now we're on the very last part of this question.
Really?
Mm-hmm. Okay. What I'm going to do is I'm going to read you a story, and I'd like for you to listen carefully because afterwards I'm going to ask you some questions about the story. Okay? All right. Jill was a very successful stockbroker.
Okay.
She made a lot of money in the stock market. She then met Jack, a devastatingly handsome man.
Mm-hmm.
She married him and had 3 children.
Wow.
They lived in Chicago.
Yeah.
She then stopped work and stayed home to bring up her children.
Okay.
When they were teenagers, she went back to work. She and Jack lived happily ever after.
Oh, that's nice.
Okay. Now I'm going to ask you 4 questions about this story.
Okay.
What was the female's name?
Jill. Like Jack and Jill. Jack and Jill. Okay. Got that.
What work did she do?
It's that stuff people do on Wall Street. She was a stockbroker, which is pretty good for a young woman to be a stockbroker.
Okay. Now let's move on to the next question.
Okay.
When did she go back to work?
She went back to work to escape those teenage children.
Oh, really?
Yes. And I don't blame her, do you? So she waited till her children were teenagers, and then she went back to work.
Uh-huh. And what state did she live in?
She lived in Chicago.
Mm-hmm. Was that the state she lived in?
Chicago. Yeah, Chicago.
Okay. Well, you did very well. We're through with this exam right here.
Good.
Yes.
Not that it wasn't fun.
Well, you did good. Now, let's add up your score and see what we've got here. We have got a total of 21 on this. And that 21 and with your education level, it indicates, Ms. Brown, that you may have a little memory problem called mild neurocognitive disorder.
What the devil is that?
Well, that's just a term they use for someone who is suffering from some memory problem. Now, what this indicates is that you need to visit with your physician, and we'll send a copy of this form with him, with you, and when you go see him.
And you don't have to give it to me again.
No, and then he'll run some further tests. You'll have a physical, yes, and then, you know, this may be something that may be reversible, and if not, then he's going to talk with you about that. And I want to thank you. You did very well.
Well, thank you.
Mm-hmm.
Well, thank you for taking the trouble to let me know this.
Okay. Now, in conclusion, I'd like to say that we need to please remember that a person's score on the SLUMS or any other cognitive assessment tool is only an indication that further testing is needed before a diagnosis can be made. And I want to thank you and then leave some time for any questions.
Yes, if anyone has any questions now, please type them in to your comment box. We appreciate it, Cindy and Gail.
You're very welcome.
My pleasure. It's not hard for me to pretend to have a bad memory.
I know what you mean. We all have days like that for sure. Okay, we're waiting on questions. We still have about 14 minutes in our hour. I do want to remind everybody, if any of your peers were not able to make this webinar today, it will be archived on the Rosalind Carter Institute website as soon as we can. We usually get it done within the next day or two. All right, Cindy, looks like we're having a question there. Can they use pen and paper for math questions?
That is a very good question, Barbara, but that they are not able to use pen and paper on this. They're going to have to calculate this in their head.
Okay, I see where Jenna has typed in that she has a question. Jenna, you need to type it in for us. Okay, Barbara, her question is, our clients probably would not know Chicago is in Illinois. How would we handle this?
That's a good question. If you're assessing someone maybe from the South, you might want to use Birmingham, Alabama. I think we probably need to address to the St. Louis University. But, yeah, that is a very good question there. Depending on their educational level, you know, what their how much they've traveled or aware of the states and cities in the states.
Okay, so Jenna has asked, so what if someone who is having memory questions to use this exam to others?
Is there other methods to check someone's memory if they have been familiar with this memory test previously? You know, that's a good question too, Jenna. During my career, I have run across people that I suspected had just memorized the answers to the questions. And there are other cognitive assessment exams for those that are higher functioning, and one of them is called a RUDAS. And that's the Rowland Institute assessment. Rowland University, I'm trying to think what that acronym stands for, but if you Google RUDAS, it's an Australian exam, and it's a very good exam as well. Now, one thing I want to point out, too, is that when I would sit down with someone and I could see that they're having a whole lot of trouble with the SLUMS, then I would switch over to the MMSE. Or if I started off on the MMSE and they scored 30 points on that, 100%, then I would ask them if they would take the SLUMS. As I said earlier, it's much more sensitive to those with mild cognitive impairment.
So, Cindy, if someone you think does have the SLUMS test memorized, you could change, for instance, you know, when you ask them to name the 5 items, you could change that or change the city, different things like that, correct?
I don't think that it's a problem in changing the 5 items. I have done that in the past for those that I suspected had it memorized. I wouldn't change any of the other questions except possibly that city in question number 11.
Okay. All right. And let's see here. Arminda has a question. When conducting an event such as a memory screen, should there be more than one tool on hand for assessment?
Well, as I said, I would usually go into any assessment with an MMSE and a SLUMS. In the event that they ace the MMSE, then the SLUMS would be used for those that are possibly mild cognitively impaired.
And I would like to address Arminda. We are going to have future webinars where we are going to do some screening tools and some assessment tools so that you will have sort of, let's say, an arsenal of different techniques that you can go into and will educate you better on, you know, which way to go. You may go in for one reason and think this tool is what you need and then realize that, oh, I need to do this other. So hopefully, you know, by the end of this year, we'll get you all trained on different ways.
Another thing I want to add too is that I always went in with the depression scale because depression is one that you would need to rule out on a thorough assessment, and so with their permission, I would conduct that as well.
Okay, Barbara has a question. Can the mini-cog be used for clients having difficulty with this test? Do you know if that tool is licensed?
Are you speaking of the mini-cog being licensed?
Yeah, Barbara, can you shoot me a yes or a no?
Well, the mini-cog can be used if they're having difficulty with this test, but I find that if they are having difficulty with the SLUMS, then the mini-mental was the next step down. And, I really don't know if the mini-cog is licensed or not. I know that the SLUMS is public domain.
Barbara, you could probably find that online.
Barbara, if you want to leave your email address, I'll be happy to look that up for you as well.
So, Barbara, if you want to shoot me your email address, you have my email, and this is Elaine, and I'll get it to Cindy to help you out. Okay, does anyone else have any more questions? We've got about 7 minutes left. Okay, you've all been great asking questions today. All right, well, on behalf of the Rosalind Carter Institute, I'm Elaine, and Cindy and Gail, we all wish you a good week. Have a great time. Thank you.
Thank you.
Thank you. Please stand by.